Hello, good evening.
Good evening, Father.
Good evening, Father.
Good evening, Father.
Good evening, Father.
Good evening, everyone. How are you doing? Yes, at YouTube. Yes. Since OET people are less, we have reduced the number of sessions. Now we have very few members, so sessions have gone low in number. So how is life going on? How is your learning going on? No signatures?
Good, Father.
Yeah, if there are new members, Arya ma'am might have told you to join the Telegram group. Otherwise, you may not get this one intimations. And also try saving my number so that you get personal messages. Okay. Then what else? Today we are diving into reading part A. Maybe the last sample we have taken a couple of them, and we just wanted to complete reading part A. Those of you who want to have it in Malayalam, already it's uploaded in Malayalam, the same reading part A. So, good evening and welcome to EduSkills. So, it made easy. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work, and share this video link to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. And today we will be dealing with reading part A. Let me share my screen. Hello, to tell me if you can see my screen. At YouTube, please respond. Can you see my screen? Yes, so thumbs up. At YouTube, hi. Yes. I'm audible, right? Audible and visible, me as well as the screen.
Yes, Father.
Yeah. Sample 3, reading part A, management of burns. This is from the official OET website. Thank you, OET, for allowing me to use this for teaching purpose. And today, every time we'll be taking different approaches. Whichever is convenient for you, you can use them, okay? It doesn't mean you have to go by this or that. Maybe every time I have given you a different approach to reading part A. So for principles of skimming, skimming is the the most important skill in reading part A. All the 4 subtests, definitely reading and listening, and especially in reading part A. You have to skim for the main heading. As I said, you should be foreseeing what is it about. As you see the main heading, today's is management of burns. Immediately you have to visualize. Probably you have an experience with a patient who had burn injuries. So just visualize a concept. Subheading of each text will have a heading, subheading. Focus on those subheadings as well. And third principle is keywords of each text and question statement. Identify the keywords in the text as well as in the question statement. Fourth principle, look for synonyms, synonymous language, and paraphrasing in the text. Synonyms means different words used, but it means same. Synonymous language means a cluster of words or a group of words or a phrase using different words. The same meaning is given with another cluster of words or group of words. Paraphrasing means the same one sentence will be written in another way or using other expressions, maybe different expressions and different words, but it means same. Okay, so what should you skim for? As I said, main heading is important. Here, management of burns, and the subheading is important. Now, management of burns. Could you just visualize and tell me if there is a patient who has come? Just imagine there's a patient in front of you who has come to the emergency with burn injuries. What will be the thing happening over there? Can you just shout out or type in the chat box in the YouTube?
Assessment of burns or
Okay, assessment of burns. Okay, assessment of burns. What will you assess?
condition of the wound. degree
How
of
How
burns.
deep is the wound? How much tissue is damaged? What degree of burns, right?
Yes.
Type of
Okay, type of burns, how deep it is, what is the percentage of burns, right?
Mm.
How many
if
percentage? Then what else? What else?
if higher degree we are providing IV fluids, or if deep wound, then we are transferring the patient in or admitting the patient in the different unit.
Okay, after admitting,
Dressing of the wound.
okay, debracing or cleaning, whatever in colloquial language, right? Okay, then
Fluid balance.
Treatment of
Fluid,
the burn.
treatment,
fluid,
what medicine? Like the person is having severe pain, terrible pain. What will you give? What will the doctor prescribe? If there are doctors, please shout out.
pain medication.
morphine,
Okay,
morphine,
some
Father,
analgesics, okay, morphine or some analgesics, some, yeah.
fentanyl,
Then anything else that comes to your mind? Okay, let's see. Now, main
We
heading,
should
management of
assess the
burns. Yeah,
Yeah, if there
yeah,
is any foreign body, and if there is, we should look the size of the burn, and then after that we have to look the assessment like the patient dehydration, pain, they complain of according to the patient. So treatment like medication and debridement if there is a tissue damage, dressing, all these include assessment.
yes. Okay, thank you. And Sunita and Ashwin says analgesics must be given. Yeah, you're right. And symptom facies, area of burns will be, yeah, signs of patient, area of burns, all this at YouTube comment space, definitely. So focus what you have to skim for. First, look for the main heading, that is management of words, then subheadings, which means the focus of each text. Each heading of each text will tell you what is the focus, what is the theme. So here you have classification, treatment, management, and guidelines. Text A speaks about burn depth or classification. You can choose anything. A burn depth heading is given there, burn depth, but looking at the text, we can also say it's classification. Just have a glance and write. Even if they have not given the heading for each text, you can read the first sentence, you will understand what it is. Okay, so create a heading if there is no heading. So classification, then text B speaks about treatment, text C speaks about management of burns, and text D speaks about guidelines. Could you just write down these four things in your notebook fast? A, classification, B, treatment, C, management, D, guidelines. Okay. These are like four subheadings, but under the same theme, management of burns. Only one theme, okay? There is no different theme for each text. Now, third one, you have to look for names. What names? Name of a condition, disease, or medication, or device, or body part, anything of this sort. Any names are important, okay? Then fourth one, you have to look for number and percentage. If they have given some numbers, just glance at it and definitely there will be answer. And fifth one, sequential expressions, initial, later, subsequently, finally, all those sequential expressions, first, second, third. Then classification. If there are classifications, first, second, third, those things are very important. Skim for it. Negative meaning. Sometimes they give you negative meaning. Same, the question and the text may not have the question may give you a positive statement, whereas text will give you negative statement. And eighth is time or duration. How long? Okay, maybe 3 weeks you will have to take a medication, or 2 weeks, or after what? Maybe after duration you have to come for review. Okay, all those things, durations are important. So just see here, and could you just shout out and in the YouTube comment space, tell me what are important here?
burn
So
Yeah,
this is
skimming.
about classification,
burn
Yeah,
like the
yeah,
heading,
burn depth.
subheading,
Okay, burn depth.
burn
One
depth.
sec. Okay, let me, yes, one sec. Yeah, burn depth. Then
Then superficial,
Superficial partial thickness.
superficial or partial thickness burns. Definitely that is a heading.
yeah.
Full
So also
Then
here there is first and second
First
main
Yes,
degree.
sir. First and
First
second
and
degree.
second is important. Then
Then
full
full
thickness.
thickness of burn.
thickness.
Those are
Third
the
degree.
subheadings. Again, in the same text, there are subheadings. So third
Yeah,
degree is
third
important.
degree. Mhm.
Yes. Then
Mixed depth of burns.
mixed depth. Yeah. So these are very important. Now this all you have to need to look into. Maybe you can read this first one. Burn injuries are classified according to how much tissue damage is present. How much tissue damage? First degree, second degree, third degree, mixed depth. So that is known as the topic sentence. This is known as the topic
Topic
sentence. And that's why I made classification from the topic sentence instead of burn depth. Burn depth also is okay. That's also classification. Or the heading I decided as classification. Okay, either you can choose burn depth as the heading or classification. That may not be exactly from the text, but just for you to understand. Okay, that is cool. Now let's go to the next text. Now, what are the important here?
Fluid resuscitation.
Fluid resuscitation.
Such as regime for fluid resuscitation adults.
This is for adults. Fluid resuscitation for adults.
Then children.
Yeah, fluid resuscitation for children.
Yeah.
You know, these are very important. I gave it
Yes.
treatment. I understood this from the fluid resuscitation. It is treatment, right? These are treatments, right?
Yes, sir.
So
Yes, sir.
I gave the heading treatment. Just I want to tell you, you can make your own heading. It's only for your understanding. And then later on, you know, there are so many numbers here, you need see numbers.
sir.
But then if you something is spoken about pediatrics or children, immediately you have to come here about treatment in the questions. If some treatment about adults is spoken of, immediately you have to look only here, not the first and last paragraph. So easy to locate and go fast. And going to third, there are so many things. So what will you look? Management.
Management.
Management is important. Management of burns. Then
Then
just glance
subheading.
the side headings. Glance the side
Yes,
heading.
sir.
Assess the patient. Assess the burn depth and
Burn depth and extent.
cooling,
Cooling.
pain
Pain
control,
control.
immunization
Acetaminophen.
status,
Immunization.
and
Debridement.
debridement of blisters,
Application of
application of
antibiotics.
antibiotics. Yeah, what you need to do is just the antibiotics, something like that. You can just underline if you want. Debridement of blisters.
Blister.
Yeah, blisters also is so cool. Otherwise, possibility of resuscitation. Resuscitation already is their general thing. It is check immunization status. Immunization status. Okay, then something like that. Pain control.
Immunization
Okay.
status. Cooling.
Yeah, all the cooling. Yeah, cooling.
And assess the burn
And
depth.
extent. And usually that will not be important because in the first paragraph they have given dealt with in detail burn depth, so you can understand it may not be that important. And assess the patient status. Okay, status of patient status. So just have a glance over these things. Okay, that's it. Skimming means it. That is the thing. Here, coming to text D.
Analgesic guidelines.
Analgesic guidelines. Okay. Now here you see pain score elicited, mild.
Yes, sir.
When you
Mild,
have such
moderate,
columns,
and severe.
yeah, moderate.
Severe.
When you have such this one tables, just look at the top column
Subheading.
where you have subheadings. Mild, moderate. These will be given in the questions, so immediately you can locate the answer. Okay, now here recommended analgesia, paracetamol, and if needed, all these things. Okay, so these are the guidelines. This line and this line, and here coming here, pediatrics. Okay, see like the other paragraph, you have here pediatrics, you have here adult, and the questions will give you some clue. Are they speaking about adult, analgesic, or pediatric?
Yeah.
So if it is pediatric, you do not bother anywhere here. You can just come down here. Only look this last portion. That's how we defeat our biggest enemy. Who is your biggest enemy?
Time.
Yeah? time. Yes. So the thing is this: strategies and tips. Step 1, skimming for a general idea. That's what we did, right? Already we have done it. And main heading and headings of each text, subheadings. These are the things we have to look into. Step 1. Then step 2, focus on topic of each text. Okay, classification, treatment, management, guidelines. That's what we have done already. Sequence of the text, as I said, that is a sequence: A, B, C, D. Classification, treatment, management, guidelines. Here also you can say burn depth. Here resuscitation, you can say fluid resuscitation, whatever, as you like. Okay. So this is the sequence, connection. You should know these connections. Then only you will be able to reach the answer very fast. So step 1 is over. Step 2, skimming. 4 texts we have done. 4 texts we have skimmed, right? Okay, subheadings of a text: A, classification, burn depth, first, second degree burns, then third degree burns, mixed depth burns. This is what we did, skimming the 4 texts. I'm just summarizing it. Text A, classification. Now, this is the thing. Already we know the basics. So, these are the things we have to highlight that we have done already. We know that. Now you see, burn depth, superficial partial thickness burns means first and second degree. Full thickness burns third degree, mixed depth burns. This is all the skimming focus. Okay, taken from here. This is what you should have in your mind as you go through the questions. Okay, so you see these 3 things. And main heading, burn depth. Topic sentence: burn injuries are classified according to how much tissue damage is present. This is very important. Usually from the topic sentence, you will have questions. Okay. Then you have the classification. As I said, I am showing it again so that you know exactly how to skim a text. And these headings, subheadings will guide you to the answers. Text B, already we have done it. All these are important. Okay. See, adults, children, all those things. Percentage per kg, ml, all those things, size, number, measurements, all these are important. Adults and children, this is very, very important. Okay, as you skim adults and children, because the question will definitely differentiate between adults and children. So immediately you can go to children or adults. If both are not there, the first paragraph. So main topic, management of burns. Subtopic, text B, fluid resuscitation. Main heading, fluid resuscitation. Then you have the topic sentence. Then you have the subdivisions, adults and children. And you have the topic sentence in the beginning. And definitely there are some percentage, percent, all those things given. Usually there will be an answer. Just check. I'm showing you the topic sentence, only topic sentence, first sentence of the text B. And we'll see how many answers will appear from there. So step 2 is main idea, subheadings of each text. Fluid resuscitation is the subheading, adults and children. Those are the 2 aspects. Third one, management. We have already looked into. Okay. And fourth one, adult analysis guidelines. So we have seen all these. Moderate. Let's check for step 3. What is step 3? Skim for stem words in the question statements. Now we have seen the main words, subheadings, concept, and skim the what you call the text. Now we are going into the question statements. Match the text. To match the text. This is for practice, okay? Gradually you will do it simultaneously. Now we are going to match the text, not just for the first portion of questions, all the 20 questions. Taking the clue from the question statement, we will be matching the text. Like here you have only 1 to 5. Match the text. Sometimes you have 5, sometimes you have 6. Most of the time you have 7 questions to match the text. Say this statement is from text A or B or C or D. Okay, now let's check. Now, could you tell me what is a hedging word here which leads you to one of these texts? Age-related consideration for initial treatment of burn injuries.
Initial treatment.
Initial treatment. Sorry.
Initial
Sorry, I am sorry. I have to mark. I have to escape. Yes. Initial
Treatment.
treatment. So which will be the answer? Where will be this one?
B.
B.
B, treatment. Yeah.
Well,
Then
treatment.
risk, the risks involved in certain treatments. Where it comes, risk
Management.
management. Risk management.
Management.
Automatically, when you know risk is, usually you say risk management. Then when to start thinking about specialist treatment. Specialist treatment. You need some special treatment after your treatment in the hospital. You need to send the patient to somewhere else. Where do you think of it? Which stage?
Guidelines.
Guidelines. Yeah, guidelines.
Guidelines.
That is the guidelines you give. You'll have to visit a physiotherapist or something like that. Specialist treatment is after the normal treatment. That is the end. Okay, treatment informed by patient self-assessment. Informed by patient self-assessment. Where it will be? Treatment informed by patient self-assessment. Guidelines. Yeah, guidelines. Yeah, this will be, you will have some doubt. Okay, we'll clarify it as you go on. How to categorize
Classification.
classification. First one. So
Classification.
all the 4 you got confirmed. Only one you have little doubt, some of you, but others got it correctly. Anyhow, sometimes you have 7, which you can do within seconds. Within 14 seconds. 70 marks. So cool. Right? And most of the texts are even easier than this. And let's check. See, initial treatment, that is correct. Risk management, special treatment guidelines, informed of patient guidelines, categorize, classification. Category means classification. Same synonyms. That's why I said synonyms are important. And as you go on, we will check the answer and verify them. Now coming to question number 6. Classification of burn injuries. Which text it will be?
Yay, Father.
Yes.
Classification.
See how easy it is. Patients recovering from 3rd degree. Where it will be?
Third degree.
Classification.
A, again A. And when evaluating mixed depth burns.
Yay.
A.
Again A. See,
Classification.
easily you can go in A, you need not look anywhere. Only in that portion where mixed depth is given. Or the previous 3rd degree is given. So immediately you can go there. We will see into it after that. 9th one. You should cool burn injuries. Cool burn injuries. Where do you cool burn injuries?
Management.
Is it management?
Yes.
Or is it management or treatment? By taking off any dash or jewelry. When do you take off jewelry and what else? Certain things from the body.
Management.
Huh?
Procedure.
Yeah, in
Management.
the procedure.
Management.
No, when do you remove the jewelry? Is it after the treatment or before the treatment?
Before
Before
treatment,
treatment.
sir.
Yeah, before you debride and all those things, you have to remove
Yes.
jewelries and all that, right? It's a common
Yeah.
sense,
Mhm.
right? When the patient comes, patient is fully burned and a lot of jewelries are there. Maybe hands are burned. There are so many bangles and gold bangles. You'll have to remove, right? Before you debride
Yes,
or
yes.
you clean.
Yes,
So it comes under treatment.
Yes, it's include of treatment.
Yeah. When cooling the wound again.
Treatment. Again,
Cooling the wound?
Treatment.
Yeah, treatment. Yeah, again treatment. B. The patient may require dash booster depending on when they were last immunized.
Management.
Management.
Yes. Yeah, booster. Yes. Then you should consider leaving dash undisturbed as this may help prevent infection. Leaving something undisturbed.
Management.
Management.
Is it management?
This also come under treatment, sir. Likely
Treatment,
consider
yeah,
leaving
treatment.
blister.
Probably. I think it must be under treatment.
Treatment.
Yeah, what blisters and other things, should you leave it or you should consider leaving may help some opinion. Okay. Yeah. You should apply ointments containing dash to all deeper burns.
Treatment.
Apply on.
Management.
Okay, let's confirm. Okay. See. Let's confirm. Yeah. See now. Classification A. No, 3rd degree A, already correct. Mixed depth A. Cool burn injuries. C. Management. Okay. Cooling the wound. This is called C. Okay, that was management. Yeah, that was, I was wrong. Yeah, that was right. You are right. Okay, cooling the wound is management. You are health professionals. You proved it. Great. And 11th one? T.
Management.
Management. And should consider leaving dash, prevent inspection. Again, management. Apply
Management.
ointments to all. Yeah.
All management.
Yes. Yeah. Now coming to 14. In the case of mixed depth burns, again. A.
Calcification,
Yes.
sir.
Yes. What is the maximum of price recommended for attaching a drip at the scene of burns incident?
Treatment.
Drip,
Treatment,
drip,
drip.
treatment.
Treatment.
Okay. Yeah. How much resuscitation fluid should a child receive per kilo over
Again, treatment.
Deep
Hmm?
treatment.
Treatment.
resuscitation fluid? Where is it?
Treatment, sir.
Let's check. Let's
Treatment.
check. There are numbers, right? 20 kg, 20 ml. All 20 kg is the number here. Okay, in the question, we'll see some numbers in the text. Before attaching a fluid resuscitation drip to a 9-year-old means you have to go immediately to children, child. Yeah. Fluid resuscitation drip. B, right? Yeah.
B,
Then what additional analgesic is recommended? In the recommended means automatically it must, in the first instance for a patient with a moderate level of recommendation. Where it happens? Recommendation.
Guidelines.
Recommended guidelines. Yeah.
Guidelines.
Definitely. Recommended means guidelines. What route should be used to administer ibuprofen to children? Again, you have to go to child. Pediatric or child. Yeah. Yeah. Administer ibuprofen. What route? What route means? Orally or through IV?
IV.
So, where it should be in under treatment or management or guidelines?
Guideline.
Mm-hmm. We'll check it. There is a doubt. After how long should a patient's pain relief regime be reevaluated again when a review comes? Under guidelines. Yeah. Cool. Let's check. Okay, 14th. Mixed depth burns A. What's the maximum number of tries recommended for attaching a drip? B, treatment, that was right. And resuscitation fluid, B, that was right. Before attaching a fluid resuscitation drip, again, drip means B, treatment. Yeah, that was right. What additional analgesic is recommended in the first? Recommended, we said D, yeah, right. What route should be used? It was in D, guidelines, you are right. Okay, I added out. After how long should a patient's pain relief regime be reevaluated? D, that is also correct. Yeah. Identify the answers in the text. Okay. We'll go to the answers. These are the answers. We'll check in the text. Okay. Sorry. We'll check it in the text. Now you see, they use synonyms. Here it is classified, but one of the questions says categorize. How much amount of? And not this, sorry, that is a healing, some other word is used, not how much. We'll check it. And considerable contraction, great deal. Great deal of, get rid of, shrinkage. Contraction, shrinkage, synonymous. Appearance, looks. Presence of, there is. What factor? Based on. These are the words used in the question. Let's check. Part A. The classification of burns injuries depends on the amount of tissue damage caused. That is 6th question in the topic sentence. I said first sentence, topic sentence are always important. So classification classified of burn injuries depends on the amount of how much tissue damage caused. Tissue damage is present. Okay. See, burn injuries are classified according to how much tissue damage is present. Classification of burn injuries depends on the amount of tissue damage caused. You have to write down in the initial stages, you have to write down this sentence as well as the question statement in the notebook. Gradually, you will develop competency in paraphrasing, understanding the paraphrasing. Now, coming back to, let's check one sec. Let me check. Yeah. See, this is the one. Second one. Patients recovering from third-degree burns are likely to experience a great deal of shrinkage and scarring of their skin. Third degree. Where is third degree? Immediately, you know that this one is here. Also third degree. Immediately, as you see third degree, you just come here. Number 2, right?
Less
This one.
father.
So immediately you come
Less-
here to find the answer. See, considerable healing associated. Patients recovering. Healing, synonym used is recovering. From third degree burns are likely to experience a great deal of shrinkage, considerable contraction, and scarring of their skin. See, whenever there is usually and or conjunctions, they test you. There are three, I think, in this test itself. You have in this A part, three using the conjunctions. If one is given in the text, other one will be blank in the question statement. Next one, when evaluating mixed depth burns, immediately you have to come here, mixed depth, right? Below. Last portion, 3. You should take into account how the burn looks and whether there is sensation in the affected area. Where is it?
First point, bullet point.
Hmm.
Your
First point.
presence of
First.
Mixed depth burns.
Mixed depth burns, let me check. Presence of
Sensation.
sensation.
Sensation, where is it?
See at the
Mixed
first
Yeah,
line.
yeah,
depth
presence
is
of
second
sensation.
line.
Yeah, second line, you see. Just check with the answer, this one. See, this one. When evaluating mixed depth burns, you should take into account how the burn looks and whether there is sensation in the affected area. Burns are frequently of mixed depth. The clinician should should take into account the average depth by the appearance and the presence of sensation. Presence of there is. Instead of presence of there is used.
There is.
Okay. Looks, appearance. Synonyms. Looks, appearance. Okay. Next one. 14th one. In the case of mixed depth burns, what factor determines the local treatment to give? What determines? Based on. What factor? Based on.
Best.
Synonymous expression. Okay. Local treatment should be based on the burn thickness.
Yes.
Factor determines the local treatment to give? Thickness. Based on the burn thickness.
Thickness.
Okay. Is that cool?
Yes, sir.
Yes, Father.
Yes. So you see, beauty of the synonyms. This are, I said, you have to keep a diary of synonyms and synonymous expressions. Question says classified. Text says categorized. Amount of how
How
much?
much?
How
Recovering,
much?
healing.
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 Great deal of shrinkage,
A score.
considerable
Considerable
contraction. These things you have to write down in your notebook, okay? You have to write down in your notebook. That's how you have to practice and gain competency. You need not by heart synonyms. Sometimes people request for a list of synonyms. No, that's not going to be useful. Just from the practice materials, you get plenty of them. Say from one text, we are getting so many of them. So if you practice some 10 materials, you will have enough and more synonyms and synonymous expressions and paraphrasing. Evaluating, estimating. Looks, appearance. There is presence of. There is means presence. Yeah. So these are the synonymous and synonyms and synonymous. What factor? Based on.
Based on.
Yes. Now text B, I am not going to analyze the whole thing. You can look into it later. Just see, I'll show you the question and text. Synonyms. Initial question says as soon as possible. Text as soon as possible. Synonymous. See, initial, as soon as possible. Time expression. Initial is the time expression. Maximum. The text says no more than 2. No more than 2 means 2 is the maximum. Okay, that's what I said, negative expression. Text says no more than 2, which means maximum. And this is synonymous expression as well as negative meaning. Yes. So scale is used, maximum, minimum. Okay. Then drip, cannulation. Then that is synonym. And per kilo over 20 kg, each extra kg. Per kilo over 20 kg is given, but question says each extra kg. Means when you have 21 kg, how much should be given? And that is synonym, synonymous. And 20 kg, 10 kg plus 10 kg.
10 kg.
Question says 20 kg, but text says 10 kg plus 10 kg. Yeah, that is synonymous. Means same, right? But then that
Yes.
may confuse you, but you should be careful. This type of questions appear very often. And last one is 9-year-old
9-year-old
child.
child.
Means children.
Children.
Yeah, synonymous. See, beauty. How beautiful. How nice. I'll see it. Once you practice, that's it. Rest C and D you'll have to look into because you have to practice yourself something, right? Is that clear?
Yes, Father.
Yes, sir. Thank
Any-
you.
And you need to visit any of the slides? Okay, then I'll stop sharing. If you have any clarifications, you can. Yes. Very few people are attending. That's why we have reduced the 3 sessions in a week to 1 session. If this is the scale, I was waiting for the people to come. More than half an hour. Till then, not even 50 people attending, not even 40 people attending. See, when we prepare and spend so much time, people are not interested in attending. Why should we waste our time? It's not easy to create so many PPTs. No? A part is very challenging to create PPT because you have to take everything from everywhere, put it here and there, everywhere. If it is C or B or C, you can easily assess, highlight these things. Any session, any, yes. Any degree of burn, types of burns. And those of you need more clarification, there is also Malayalam video explanation, same explanation uploaded, even with more PPTs. I missed those PPTs, what I used for Malayalam session, then I had to make it again. I didn't find it, but Malayalam session I have more PPTs where I have shown all the things in the questions and the paraphrasing in the text itself. Any clarifications?
Father, I need little clarification on fact and opinion-based question. I have a confusion on that.
What you can do is to go to EduSkills OET reading / fact and opinion. You type, you will get plenty of explanations, different types of questions.